Hi everybody, my name is Cher. I'm a respiratory therapist here at Lifespan Home Medical.
Hi, I'm Elena, also a respiratory therapist at Lifespan Home Medical.
We are creating a video of a tutorial for a CPAP setup to accommodate patients at home due to this crisis that we're dealing with. So I'm just going to get into that. So Elena is going to be my patient today. So first off, you would receive a CPAP. It's fully packed and it's going to be set per the doctor's direction. So we'll get into that and then we'll get into masks after. But we have a front pocket here. This is just for any storage. We have the great travel bag. In the front pocket here is some information. So this first one, it talks about how you can track your information and see all of your stats online. So it tells you on a daily basis how you're doing. As long as you log in to either this website here, or if you download the app right here, it'll give you a quick rundown on a daily basis how you're doing, whether it be how many hours you're using it, how well your mask is sealing, and also how many events you are having per hour, in hopes that by the 30th day, you're having less than 5 events per hour. That's our goal with CPAP. So this can help you kind of keep track of that. This right here is an advertisement for a traveling CPAP, but it is not covered through the insurance. This right here is a quick reference guide on how to put everything together. And it just gives you some quick tips on how to put your machine together and different screens and things. The next thing is the actual guidebook. So if you have more detailed questions or information you want to look up, you can look in here. It's in 4 different languages. Okay, so we're going to put that back in the front pocket. There are different components of this CPAP. So we have a tubing, heated tubing. We have a water chamber, and this is where you are going to put the water that provides humidification of the air so you don't get dried out. We have the CPAP machine itself and the power cord. All right. So on the side here is where we're going to insert the humidifier, in which gives you humidification so your mouth doesn't get dried out. So it's suggested to use distilled water. So you can find this most of the time, other than possible times of now, at a grocery store or a drugstore. I have heard there's a shortage, but if you cannot find it, just use regular bottled tap water. Bottled preferably, tap water not, but if you can locate this, please use the distilled. If not, bottled water I think is the next best thing. So we'll put that down here. So you want to open the water chamber on the side here. There is a max line. You want to pour the water to the max line. Close it. Every day you want to put fresh water in. If anything is left over in the morning, you want to throw it out, put fresh water in. And we're just going to slide this into the side here, just like that. Very simple. To take it out, we just grip the side where this white piece is, and we pull it out. Just like that. Okay? Push it back in. The next thing here is our tubing. So it is a heated tubing. It is heated because it will heat the surface of the tubing to stop any water condensation that builds up in the tube, so that you don't get water droplets dripping into your mask throughout the night. So it's just a little bit smarter than a standard tube. So it has a little metal piece here, and we're going to use that metal piece. It's only on one side. So this is going to plug into the mask. This is going to plug into the machine. So we go in the back here. If you look, there's only one way it can be put in. So it's going to be put into that hole right there. Click in, and it goes just like that. Okay, you can move it side to side, depending on what side your bed's on. And then to take it out, we're gonna grip these 2 tabs here, pull it out, and that's pretty much it. And then put it back in the same way. All right. Then in the back here, we're gonna plug it in this little hole. Then on the side, we have a filter. So this filter, you open it up with this little door here, and you wanna check on this about once a month. When it starts looking dusty, turning gray, you wanna throw this one out, put a new one in there. Okay, so we just put it in like that. Do not try to wash it, just throw it away. This is a port for a data card. We do not need to have it in there because this machine is going to transmit via modem. Built in on the inside, you don't have to connect to Wi-Fi. It's gonna transmit through the cell phone towers. So this is just as a backup. And this is a port for additional testing. Don't worry about that either. Okay, so now we're gonna put it down. We're gonna plug it in. And all we're going to worry about doing on a nightly basis is putting fresh water into the humidifier and turning the machine on. Okay, so that's all we need to do. We don't need to scroll through menus or do anything more in depth. That's basically all you got to worry about doing every night. So we're going to turn this on. Plug this in. And basically the machine is turning on. It's getting started up. And all you want to worry about doing tonight, we're going to get to the mask in a second, but basically you're going to put some water in this water chamber here, and all we're going to do is hit this top button. So this is the top button here. Do you want to grab the camera maybe?
Yeah.
We're going to push this top button. This is the on button, and it has a little light there. All we're going to worry about doing is putting water in here every night and pressing this top button. So we turn the button on. When you see the circle, that means it is functioning and it's on. Okay, so depending on your settings, it's going to say your particular range. Everything dims out after a couple seconds so it doesn't keep you awake. But the machine is on and running. If you want to look at the screen, you just press that button or press this button and it lights the screen back up. So you're going to use it like this throughout the night. In the morning when you're all finished, you shut it off with the same button. Gives you a report of how you did, how many hours you used it for, how well your mask was sealing. So this mask seal face is currently green. We want it to stay green. If it's not green, that means that your mask is not sealed properly or it's getting old and you need to replace it. So we'll talk about that in a second, but that means you have a good seal going on, you're getting the proper pressure you need. The humidifier face, if that's ever red, that means there's an issue with the machine. You got to call us. And if you scroll down with this dial here, if you push that dial in, it tells you the name of the website again, where to track your information. Okay, there's a little snowflake blinking here. That's telling you anytime after you use the machine and turn it off, it goes into a 1 hour cool down period. And it's just cooling the system down after usage. And then this little bars here in the corner is indicating obviously your signal. So as long as you have bars there, the machine will continue to signal. And that's pretty much it. That's the basics. That's the rundown of what you need to do to use your machine. Now we get into the whole mask scenario. So we have 3 different style masks that we're going to choose from for now, because these are all the easiest styles that provide fit pack components. So this one here, this is a very simple mask for patients that want the minimal mask on their face. So this is the smallest style mask. If you want to show on the head here, that's how it looks. And it goes inside your nose to get the air in. However, we have to remember it does not cover the mouth. So it's only nasal, okay? It comes in a small, medium, or large pillow size, which is right here. It says a M or a S. So this one comes in a fit pack. You should be able to see what size feels the most comfortable for you and use that pillow if that's the mask that you want to go with. Then we have a different one, very similar but also different at the same time. Instead of going inside your nose, it goes around your nose. So some people don't like the feeling of having something in their nose. So having it around your nose might be a better option for you. But still, it's not covering the mouth. So the reason why I'm stressing this is because if you sleep with your mouth open, it is not going to support your needs for CPAP therapy because the air is just going to escape right out of your mouth. So that brings me to the full face mask. Okay, so it's this guy right here. This one's going to cover your nose and your mouth. Again, it's right here on this head. So you can see it's covering his nose and his mouth, and we have a way of securing it with these magnets here, which are pretty cool. So they secure very nicely just by a magnet. The only thing is, this does not come in a fit pack form. So we actually have to stress that people are going to have to size themselves. We haven't figured out how or when prior or whatever we need to do, but this is sized with a sizing tool, whether it be small, medium, or large. So this gentleman, for instance, we hold it up. This arrow needs to go right in this crease right here, right between your eyes. So you can see here, he falls within a medium. We want it to be right underneath the lip. That's where it needs to fall. So you can see the blue is right in that crevice right there. So that's his size medium. So that's pretty much it. So now we're gonna have Elena demonstrate how we're going to put her actual mask on. The nasal pillows and the other nasal mask that I talked about, this style right here is very simple. It either goes right inside your nose or right around your nose. But we want to demonstrate the usage of this full face mask because we want to make sure people have it strapped, you can take it all out, and adjusted properly. Because this is probably a more common mask that people are going to use because a lot of people do not know if they are mouth breathers. So if they are a mouth breather, we're going to highly, highly, highly suggest you use this mask because it contains the air by covering your nose and your mouth. So you can see here, she's going to put it on her face. She's going to put that's a little elbow piece that's going to connect directly into this tubing. Okay, now that's a quick disconnect. If you need to get up and go to the bathroom, you can disconnect like that, go to the bathroom with your mask on, come back, connect it back in, and you're all set to go. And then you turn the machine back on. Boom. Then, if you want to demonstrate the cushion on how the cushion comes off of the frame of the mask. So this is a replaceable piece that you just squeeze the bottom two corners.
Sometimes
the first time it's a little bit harder because it's a new plastic. But just keep in mind, it does come off. It comes off for replacement purposes. This silicone material starts to break down between 1 and 3 months. So when that happens, it means that you don't need a new mask in total. You just need a new cushion is what it's called. And the same thing happens with these guys right here. So for instance, you can replace these by pushing this tab out, and now we have this piece that comes off of the mask and we can replace it. So these are all replaceable because they do break down over time, okay? So we've put that back on the frame. Now Elena is going to demonstrate on how to put the mask on properly to get the best seal. And she's going to take our mask off first. It's caught in the earring. So let's see.
Oh, geez.
Okay, we got it.
Okay. So the best way is to put the mask right where it's going to fit and then put it behind. I've actually never done this before,
So put the mask on your face, then pull the straps up and over. And you're going to put the magnets on. Now we need to make sure we tighten the mask, but not too tight. We just want it tight enough to where it's not blowing off with the pressure of the air, but also creating a good seal.
Interesting. I've never done this.
So you have Velcro there, in which allows you to tighten.
I think I'm twisted right there.
A little twisted. So that might happen. It's going to take some practice to get used to how to take this mask on and off and have it fitted well where the seal is fantastic. So we're not going to turn the machine on for her, but basically we're going to hook that right in there, and then all we're going to do is press this button right here. That is the on button, the button with the little light on it. Okay, and that is it. So you're going to do that on a nightly basis. And the main issues you may run into is mainly humidification issues. If your mouth starts getting dry, if we go in here, if we press this button here for the house, we now have 2 screens, My Options and Sleep Report. The Sleep Report is what we already went over. It has the smiley faces, so this is just a report saying how you did on a nightly basis. So we're all set with that. We already went over that. But if we go into My Options, it'll give us a listing of multiple different things. I wouldn't worry about scrolling through here for, for anything other than this option right here, which is called climate control. So that's referring to the humidification. So basically we start everyone off on automatic. It's going to try to adjust depending on the humidity in your room, and it's going to try to give you the humidification it feels as though you need. However, it doesn't always work out perfectly. So if you start to get dry mouth, you can give a therapist a call, or you can try to do this yourself, but we want to take it off of an automatic mode into manual. Now we have the capability right here to go up as high as 8 and as low as off. Okay, so 8 being the most moisture that you need for your mouth if your mouth gets dry, and 1 being the least, obviously. So I always tell everyone, if you start getting dry, you want to start at 5 and go up by 1 each night if you're still having dry mouth. Okay, now you can also see here there's an option for tubing temperature. Tubing temperature has nothing to do with how dry your mouth is. It only has to do with water condensation building up in this tubing and dripping down into your mask with increased humidification that we provide with this water chamber here. So if we do get water build up in your tubing, you want to change this. So I suggest going to about 80. Now that sounds high, but it means that we're just trying to heat up the surface of this tube to stop water condensation. So that's that. So that's really the main 2 issues that you're going to have, but we're going to start out at automatic and start there. If you don't have any problems with dry mouth or water in your tubing, then you should be all set with this current mode that we put it on. We also put the tubing temperature in auto as well. And that's pretty much it. So we will check on you in 1 week, see how you're doing, and then we will give you a call at the 30th day to let you know the results and let you know that we are sending the information to the doctor via fax. However, most doctors do have access to this remotely via their computer as well. So I think that's it. Any other things you want to add?
Just how to take the mask off.
Yep.
The easiest way. So you would just unsnap the magnets
and then take it off. And that way when you go to put it on at nighttime, it's already sized for you. You don't have to fiddle with anything. You just take the magnets off again when you go to put it on at night.
put the mask to your face first, and it's already sized. And then it's just a simple little snap, snap.
Beautiful. Okay. The one last thing I do want to mention is obviously cleaning guidelines. We're going to include this in our paperwork, of course. But the cleaning guidelines include on a weekly basis, once a week, you want to clean the mask in total, this tubing, and now you can take this tubing out and get this metal piece wet. That is fine. You want to submerge the entire mask, the entire tubing, in this water chamber in warm soapy water in the kitchen sink or in a big bucket. Dish soap is perfectly fine, whether it be Joy, Dawn, anything that's more gentle and does not have perfumes or lotions. And basically you put that in the water, let that soak in there for about 10-15 minutes, rinse it out and let it air dry. So once a week. And then the resupply status for items is you can get 1 tube every 3 months. You can get 2 filters every month. You can get 1 water chamber every 6 months, a mask in total every 6 months. But the cushion that we talked about, that replacement cushion, you can get them as frequently as once per month. Okay, this little silicone piece right here. Now, this can differ per your insurance guidelines and what they allow, but that's for the most part. If not, we will let you know depending on your insurance. But that's pretty much it. So pretty simple. It's going to take some time to get used to. And, you know, we suggest to use the CPAP in the beginning while watching TV or on your phone to distract you. You can use it while you're awake as long as you want to. That can help you get adjusted to using CPAP therapy. If you have any problems, you then give us a call and we can walk you through things over the phone. Anything else you want to add?
Just the compliance stuff.
Yep, in the compliance, you want to make sure you use the machine at least 4 hours a night. That's your goal to work up towards by the 90th day of using this machine. So there's a 90-day trial period. If you do not use it enough within the first 90 days, the insurance can stop paying. So your goal when you wake up in the morning is to see 4 hours of usage there. If you do have at least 4 hours, you are doing the right thing. It does not have to be consecutive. You can get up, go to the bathroom, come back, and it will continue on within a 24-hour time frame. So I think that's it. I think we've covered it all. Okay, great. Thank you so much. Give us a call if you have any problems.